Great. So I'm excited to introduce today's session titled Transforming Access to Contraceptive Care, the Role of Medicaid MCOs, brought to you by Upstream USA. Upstream USA has been a great partner to both MHPA and our health plan members, and I want to thank them for pulling together to today's session. With that, I will turn things over to Emily Eckert and Kimberly Potter for introductions and today's content.
Great, thank you so much, Eric, and thank you to all of our attendees. I still see some folks trickling in, so welcome. Thank you so much for joining us again for today's webinar titled Transforming Access to Contraceptive Care, the Role of Medicaid Managed Care Organizations. For those of you who are unfamiliar with Upstream, we are a national nonprofit working to ensure that equitable patient-centered contraceptive care is basic healthcare. And we are really thrilled to be an MHPA partner organization. This is our first year as an MHPA partner. Next slide, please. There we go. My name is Emily Eckert. I am Upstream's Associate Director of Federal Policy, and I will be sharing the stage today with my wonderful colleague, Kim Potter, who is one of Upstream's Vice Presidents for Practice Transformation. We are thrilled to be with you today talking about two of my favorite topics, Medicaid and family planning. Specifically, we'll be discussing the unique role of Medicaid Managed Care Organizations, or MCOs, in providing access to family planning care and how partnering with Upstream can help MCOs offer higher quality contraceptive care to their health plan members. Next slide. As many of you likely know, family planning has been a required benefit in the Medicaid program since 1972. Today, Medicaid represents the largest source of public funding for family planning services and also finances about half of the nation's births. Given the changing landscape of reproductive health access across the country, Medicaid Managed Care Organizations have assumed and will very likely continue to assume really an outsized role in providing contraceptive care to their health plan members. Doing so is critical considering that more than 3/4 of women of reproductive age who are entitled to comprehensive Medicaid coverage are enrolled in and receive their healthcare services through managed care. Next slide. So let's talk briefly about some of the existing federal requirements placed on managed care plans with regard to family planning. Hopefully you are familiar with most of these. So first, I want to highlight the freedom of choice requirement. While managed care systems typically utilize closed or controlled provider networks, federal law outlines exceptions to this standard specifically for family planning. This critical protection prohibits managed care plans from restricting an enrollee from obtaining family planning services and supplies from a provider of their choosing, even if that provider is out of network. Moreover, a plan cannot require an enrollee to obtain a referral before choosing a family planning provider. Plans must also comply with appointment wait time standards for routine visits to both primary care providers and obstetrician gynecologists. In both cases, appointments must be made available within 15 business days from the date of the request. This is to ensure that preventive care, including contraception, can be accessed in a timely manner that is convenient for the patient. New rules from the Medicaid Managed Care Final Rule published earlier this year also require health plans to provide data to state-developed quality rating systems, and this includes data on contraceptive provision in the postpartum period. And the last thing I want to highlight is that plans are required to ensure that their members are able to access the contraceptive method of their choice, free from coercion or mental pressure. So while states and managed care plans do have the ability to apply appropriate limits on a service, including utilization control criteria, such processes cannot interfere with a beneficiary's choice of contraceptive method, including the choice of no method. Importantly, this short list is non-exhaustive. There are a number of additional federal requirements that state Medicaid agencies and MCOs must follow. These are outlined in greater detail alongside several recommendations and best practices for strengthening access to and the quality of family planning services for Medicaid beneficiaries in an August 2024 informational bulletin from the Centers for Medicare and Medicaid Services. In addition to these federal rules, plans may be subject to and should be familiar with individual state requirements with regard to family planning. Next slide. So before I pass it over to my colleague Kim, I'd like to highlight what we know about how MCOs themselves, so you and your colleagues, think about family planning. Research from Sarah Rosenbaum and colleagues from the George Washington University Milken Institute School of Public Health demonstrates that Medicaid health plans recognize both the value of and their unique role in family planning. Specifically, health plans overwhelmingly prefer network inclusion of family planning providers in their service areas. Despite the fact that family planning services are available to members on an out-of-network basis, which again is the freedom of choice requirement I just mentioned, managed care plans overwhelmingly view family planning as an in-network service that they seek to make available to their members. Additionally, we know that health plans by and large perceive family planning as a key element of primary care, but also recognize it as a specialized care need. Most plans prefer their members to remain in network for family planning services because they view family planning as part of a comprehensive program of primary care services. These plans place special value on providers that can offer the full range of primary health care, including family planning. Lastly, health plans report that providing adequate access to family planning for their members is an ongoing challenge. Plans across states reported that their rural service areas experience underlying shortages of family planning providers and highlighted that provider recruitment alone is insufficient to addressing access problems for their health plan members. And this last finding mirrors results from the Institute for Medicaid Innovation's 2023 MCO survey. Next slide. According to IMI, 63% of Medicaid health plans identified low or no availability of providers in certain geographical areas as a top barrier to addressing the sexual and reproductive health needs of their members. And I'll note that the 2024 IMI study is coming out, I believe, on Friday, so this data will hopefully be updated very soon. If this rings true to you, if you are concerned about the ability of your health plan network to meet your members' family planning needs, Upstream is here to help. I'll pass it over to my colleague Kim to tell you how.
Thank you, Emily. It's lovely to be here with you all. Good morning, good afternoon, depending on where you are. Again, my name is Kimberly Potter, and I'm one of our VPs of Practice Transformation. I know Emily already said this, but I think it's so important that I'm going to say it again. At Upstream, our mission is to ensure that equitable, patient-centered contraceptive care is basic health care. And so Upstream is working to transform the provision of contraceptive care by helping to bring contraceptive care into primary care. And to date, we have worked with over 150 healthcare organizations across the US to pave the path toward that transformation. We are also partnering with the US Department of Health and Human Services to really identify those areas of high need for contraceptive care. So really those places where people of reproductive age may lack reasonable access to the healthcare centers that offer that full range of contraceptive methods. And we are really eager to expand our partnership network to include more Medicaid MCOs. You can go to the next slide for me. And so we talk a little bit about how Upstream does this work. So drawing from the guidance and best practices established by prominent organizations and institutions, including the CDC, OPA, and ACOG, and really reinforced by our work on the ground for the past 10 years, we developed a set of patient care standards that we use to guide and support healthcare center partners. We support partners in achieving these standards because we believe they can help close gaps in contraceptive care and address the inequities we know exist in reproductive health care. So we support health centers to standardize contraceptive care so that all patients who are capable of becoming pregnant are being universally screened for their reproductive health care needs so we can better understand what's important to them. If a patient is interested in preventing and/or delaying a pregnancy, they're offered education and counseling where that patient, through expressing their individual needs and desires and reproductive health care goals, guides the conversations around which birth control options would be right for them. And then through shared decision-making, that patient is able to decide on the contraceptive care that is the plan that is right for them, even if that plan is choosing not to use the method at that time. However, if they do choose to use a method, they're able to leave with their method of choice, ideally on that same day. This approach to patient-centered contraceptive care really aims to reducing bias and coercion so patients can feel empowered to choose what might work best for them. And we believe that this leads to patients feeling more engaged in their healthcare. It increases patient satisfaction with their providers and the care that they're receiving and paves that path toward better health outcomes. Go to the next slide for me. So the technical assistance that Upstream offers is focused on these 8 foundational building blocks, which really help expand and enhance contraceptive care. We focus on strengthening the skills and capabilities of care teams by ensuring that a health center has a sufficient number of providers, and this includes primary care providers, that are trained to screen, counsel, prescribe, and place and remove that full range of methods. We also work to support health centers in establishing a team-based approach to contraceptive care, so equipping all staff who may have some patient contact to be a part of a contraceptive care workflow. We also focus on those systems and resources that can support this kind of care model. We also looking at things like accurate and up-to-date billing and coding practices to support reimbursement, utilizing an electronic health record to support patient-centered workflows, storing on-site provider-administered methods like IUDs and the implant and Depo-Provera to make sure they're there if patients choose those methods, and developing referral protocols for when patients can't access their method of choice on site. Then thinking about utilizing engaging and patient-centered education materials. And then finally, we support health centers to have up-to-date policies and procedures and protocols to codify this method of care and help sustain that care over time. At the outset of every partnership we have, we conduct a baseline assessment that really helps us understand better a health center partner's current state of contraceptive care. What are their challenges? What are their barriers? But also looking at what strengths they can build upon when we think about supporting these changes. Based on what we find, we customize an implementation plan that really helps address those unique barriers and that can really increase access for the health center's patients. This may mean we do not focus on all 8 of these things. Instead, we really want to make sure we hone in on the ones that are really most impactful for a health center partner. Go to the next slide for me. And so overall, Upstream's approach is comprehensive, it's impactful, and it's designed around the unique needs of a healthcare organization and the providers that we support. Our program, again, takes that tailored approach that respects a health center team's time. Most of our work happens virtually to ensure that we can fit into the busy health center culture and schedule, and it emphasizes sustainable changes. From the start of every partnership, we support partners in building sustainable practices so that they can offer patient-centered contraceptive care long after our engagement ends. This is done through this wraparound approach that includes a dedicated Upstream team that is comprised of a cross-functional group of practice change experts, which also provide additional project management capacity for this work. This cross-functional team is really there from start to finish. We guide the health center on that implementation and ensuring that staff feel equipped to provide high-quality contraceptive care. Again, as I mentioned, that includes providing a tailored implementation plan. We use that baseline assessment to learn what is already working well at the health center and where are those opportunities to improve. We use that assessment to co-create a tailored implementation plan so we really can spend our time where the help is most needed. That implementation plan highlights the technical assistance, which will focus on helping a health center to design a reproductive screening-based contraceptive care workflow that, again, leverages the whole care team. We also are able to provide CME-accredited trainings that are tailored to the different care team roles so that each person is prepared for the contraceptive care tasks specific to their day-to-day work. We also are able to provide valuable measurement tools. We know that data always plays a very critical role in any healthcare practice transformation or quality improvement initiative. So we help our partners use their data to measure implementation and practice change. Our patient survey and our data analytics platform really gives actionable insights into patient experience of care, workflow consistency, and those opportunities for continuing quality improvement. I'm going to come back to the data in just a second, but finally, we are also able to offer financial resources in the form of milestone payments that help offset some of the resource and staff time that are spent on these contraceptive quality improvement initiatives. Go to the next slide for me. I'm going to come back again to data because, as we all know, data plays a critically important role in our partnership and any quality improvement initiative. It informs how practice change is happening and how it's impacting patients in the health center, and also highlights where there are places we can help improve. Our monitoring and evaluation approach relies on these three key buckets of data for measuring outcomes. First, we look at staff development insights. So, did our training equip a care team with the knowledge and skills they need to provide high quality contraceptive care? We also look at patient experience insights. So, this is always something that's very high interest to our partners. We do this through a tech survey to help us understand, do patients feel like the services they're receiving are truly patient-centered and free of coercion? And are they able to get the method they want if they want one? And finally, we look at workflow insights. So using electronic health record data helps us understand if that reproductive screening-based contraceptive care workflow is actually being implemented. For instance, it allows us to look at whether all sites are screening patients for reproductive health care, or are some doing it more consistently than others. And this really helps inform where we might spend more time on that quality improvement. We're really proud to offer through our partnership EHR and EMR integration with a population health platform, which is Azara Healthcare. That connection populates a dashboard with contraceptive care measures that our partners and Upstream can use to monitor changes over time. It allows us to look at changes in screening and the contraceptive care services that are being provided, even at an individual provider level. So again, we can focus our quality improvement efforts in the right places. And additionally, we're able to use that connection to facilitate that text-to-patient survey. I just want to call out, very importantly, that Upstream never has access to protected health information. And we also never set targets on uptake of any particular method of birth control. We want to make sure that patients have access to that full range and they can choose the method that's right for them, even again, if that's no method at all. And setting targets on that method mix could potentially lead to situations of coercion, which obviously we would want to avoid. I am going to pass it back to Emily now, who is going to wrap us up.
Great, thanks, Kim, and thanks, Stevie, for jumping slides. As Kim mentioned, and was featured on that map graphic earlier in the presentation, Upstream is on a path to achieving nationwide scale, and we are really looking to grow our partnerships with health plans in 2025 and beyond. Partnering with Upstream can help MCOs achieve the triple, quadruple, and believe it or not, even the quintuple aim of improvements in health equity, provider experience, population health metrics, and patient or member experience, alongside reductions in cost. With regard to health equity, Upstream's program trains providers to deliver non-coercive, person-centered reproductive health care to all patient populations, respecting patients' choices and preferences regarding contraception. With regard to provider or care team experience, Upstream trained clinicians are confident in their ability to deliver person-centered contraceptive care. Upstream's training program is designed to close knowledge gaps and incorporate contraceptive needs screening and, where appropriate, contraceptive counseling into existing clinic workflows in a sustainable manner, which promotes increased provider satisfaction. Upstream's program also supports quality metric performance on key population health indicators, including those related to maternal health. With regard to patient or member experience, Upstream focuses again on person-centered contraceptive care, which can improve member satisfaction and strengthen member retention. Lastly, Upstream can help MCOs generate both short and long-term healthcare savings by addressing unmet contraceptive needs and connecting members to appropriate care. Next slide, CV. Thank you. So that's really the bulk of our content. I'm glad we didn't take up too much time because that leaves plenty of time to take questions from the audience. So I'm just going to pause for a moment and see what trickles in, and then we'll get into the questions. Thank you. Wait for questions to come in. Kim, this occurred to me while you were speaking. We tend to use the term health center when we're talking about our partners, but I'd love for you to define actually who is typically within the universe of a clinical partner for Upstream.
Absolutely. I would say that is a very wide range. We work quite frequently with federally qualified health centers or FQHC lookalikes. They are often very mission aligned with Upstream and the work they're doing and are very patient-centered, ensuring they are meeting the needs of folks who are often lacking in access. So those are frequently our partners. We do work with also health systems, so large hospital systems and health systems, both in supporting contraceptive access in outpatient settings, but also in inpatient settings immediately postpartum. And I would say we also work with health departments that are able to provide reproductive health care and family planning health care. We have supported Title X folks, and also kind of other family planning or reproductive health only clinics to strengthen their care access.
Thanks, Kim.
Mhm.
There we go. Now we can see each other a little better too. Thanks, CV. Okay, I'm going to pose a question here that I see says, what are some measurable outcomes that MCOs can use to evaluate the success of partnerships aimed at expanding contraceptive services? Kim, do you want to take that question?
And yes, I think, the first thing you want to look at is screening rates. I think the most important thing in the first part of ensuring that patients have access to patient-centered contraceptive care is whether or not they're being asked about their needs. And so in the work we do, we recommend that that is happening at least on an annual basis, whether it is happening when patients are coming in for physicals or women visits, but ideally patients are being asked once a year what their reproductive health care needs are so that providers can have a conversation on how we best support that. I think that is where I would start. And then again, just kind of looking to ensure that patients have access to that full range of methods. As I mentioned earlier, we don't want to set any targets on any one particular method. So, we don't want to set targets on this many IUDs or this many implants being provided, but really ensuring that patients have access to that full range and making sure that there aren't barriers to one method or another. So really looking at a robust kind of method mix is available at a health center.
Thank you, Kim. I'm tracking the Q&A here. I'm going to combine a couple of related questions. I'll read them both verbatim, but then I'm going to we'll just combine our answer. So we've got one question that says, who from a managed care organization would Upstream speak with about partnership? As in, which types of roles? What would Upstream expect of the MCO partner? And then we received a similar question. What does an MCO partnership look like to you? So I think we can maybe tag team this response a little bit, but Kim, why don't you go ahead and start?
Sorry, I had to find my unmute. I think, from my angle, thinking about the practice transformation work, I think MCOs are really helpful in helping us reach healthcare organizations and providers to support them in their goals to increasing and improving patient-centered contraceptive access. So I think really leveraging their network and helping us connect to health centers that would need this type of support, thinking about, which health centers might be struggling in access, whether they're rural or ones that just really need additional support. So really making those connections for us is one way that I see a great way to partner with MCOs. Thinking about, again, we can bring the practice change experts to support health centers to really be meeting those best practices and those benchmarks that Emily laid out earlier. And Emily, I can kind of turn it to you for the second part.
Sure, I totally agree. I think that's sort of our primary vision of partnership, but I also would lift up that, again, on that map graphic, right? You folks saw that we're doing work across 30 odd states these days, but there were only 2 little purple dots on the map highlighting where we're working with a health plan. So I just want to acknowledge that health plans really are a new type of partner for Upstream to work with. And so in addition to, working together on sort of that core programmatic practice transformation work, which is really the heart and the bread and butter of what Upstream does, I think we are also interested in sort of flexing our expertise and what we bring to the table to a health plan partnership. And that might include, providing policy expertise or guidance, or supporting health plan efforts around value-based payment, or looking at different quality measures sort of at the plan level versus the practice level. So I think, we would be eager to entertain conversations, of course, about partnering on the programmatic side of things to really upskill your network, but also, want to be creative and be nimble and think about different ways that we might be able to work together. Pull the Q&A back up here. There is a question about it says, how might Upstream support Medicaid MCOs in complying with federal family planning requirements? So I'm happy to start here. This was towards the beginning of the presentation, so maybe folks joined late, but either way, happy to reiterate. Health plans are subject to several federal and likely additional state requirements with regard to family planning. The most basic one is that family planning is a required service in the Medicaid program. But the two I think I would highlight again here for emphasis in response to the question are the appointment wait time standards that are set at the federal level and were finalized again earlier this year as part of the Medicaid Managed Care final rule in the Biden administration. And then also the requirement that your members are able to access the contraceptive method of their choice free from coercion or mental pressure, which is a longstanding federal requirement. So again, by up-leveling the skills of the primary care providers in your health plan network, MCOs will just be better able to meet those appointment wait time standards because you are sort of equipping primary care to free up appointment time with OBGYNs by, sort of sharing care that can easily be delivered in a primary care setting. And, that training again can also help to address the finding from the Institute for Medicaid Innovation survey that said, 63% of health plans actually identified low or no availability of providers as a top barrier to addressing sexual and reproductive health needs of their members. And with regard to the requirement to provide care that is contraceptive care, access to family planning that's free from coercion and mental pressure, we've mentioned several times that that's really a core component of Upstream's programmatic work. It really centers on helping folks identify their personal biases and equipping them with skills to mitigate the risk of reproductive coercion as they deliver clinical care. We teach these skills to the entire care team, which will really just enable your network of primary care providers, again, to meet that federal requirement. And Kim, that's what's top of mind for me, but I'll reiterate the question again and see what you might have to add. So the question was, how might Upstream support Medicaid MCOs in complying with federal family planning requirements?
Yeah, happy to take that from sort of the program side of things. As I mentioned earlier in some of my slides, our program approach is really built on a foundation of best practices that are coming out from the CDC, Office of Population Affairs, ACOG, and in particular, we really leverage the quality family planning guidelines from OPA to kind of center our program. And again, focusing on screening, that patient-centered contraceptive counseling and education, making sure patients have access to same day or same visit to the full range of methods. And so thinking about meeting what those guidelines are, that is already built into our program approach. We are very eagerly, as I'm sure lots are waiting for the updates to the QFP to come out to make sure that we continue to have a program approach that's aligned. However, we're already focusing on many of the things they're thinking about. What are the changes that are happening in sexual and reproductive healthcare field, thinking about up-to-date practices and technology. Again, really that highlight on patient-centered care and thinking about an inclusive approach to family planning. This is very much how we approach our work, again, of, emphasizing there's no wrong door for patients to access family planning services, that they do not need to go to a women's health or an OBG service line, that they can access the care they need, even in family medicine, adolescent health, so other primary care service lines. And, thinking about the training that we offer, we have a group of clinical advisors who are practicing in the field that really ensure that all of our training is up to date with current best practices in reproductive and contraceptive care. We review our training on an annual basis to make sure that it has stayed in alignment. And the wonderful thing about our partnership, and really speaks to that sustainability, is the training that we are able to offer a care team, so clinicians as well as different support staff, whether they be nurses, medical assistants. People have access, our health center partners have access to that training ongoing. So it lives on a learning management system. So we are able to train a whole health center during a partnership. And then when that partnership concludes, they can continue to use that training to make sure that their care team is sort of up to date in the reproductive healthcare best practices. And which, again, we are taking responsibility on that back end to make sure we are updating that on an annual basis.
Great, thanks, Kim. This is me again, just realizing, oh, this might be something of interest to this audience. So no one has asked this question. I'm just going to pose it. One of the unique sort of advantages to being a part of Medicaid managed care versus fee-for-service, right, is that you have this health plan that's really interested in their members' health, in making sure people are accessing preventive care or any specialty services. But also, plans just have sort of a heightened degree of access to these folks in terms of, sending text messages or mailing out important resources, doing patient education and things like that. So it's occurring to me that the folks on the call might be interested in hearing a little bit more about Upstream's patient education materials and what in that regard might be made available to them through a partnership with Upstream. Can you talk about that a little bit, Kim?
Yeah, absolutely can. We are very proud to have kind of a full suite of patient education materials that we developed, really using a patient-centered approach and doing focus groups to make sure that we were speaking to a wide range of patients' needs, and created several different resources that really focus on different aspects of the different methods, recognizing that some patients may be really interested in effectiveness or efficacy, where other patients may have other interests when they're choosing a birth control method. And we really want to, again, speak to what patients are saying their needs and their desires are around their family planning goals. And so we have a whole set, again, of these resources. Some are geared to health center staff to really support them in having those patient-centered counseling and education conversations. And some are really geared at helping patients understand how to have that conversation and really thinking about how to advocate for themselves and what should they be thinking about as they're choosing a method, because we know that there are a wide range of methods and there are patients that like every single method. So we really want to help patients understand that, they have many choices and they have many considerations in thinking about what is really going to best meet their needs. So we're able to provide an entire set of those to our health center partners. We provide one whole set for each exam room, recognizing that people don't want to be passing them around. We want to make sure they're there and available. And then we have them for health center partners if they want to replenish them over time. We currently have those materials both in English and Spanish for our partners.
Great, thank you, Kim.
Mm-hmm.
We've had a question come in around how this type of partnership, or the work that we do in particular, relates to or can be tied to relate to health plans' work on maternal health. I'll just add a little flavor to this question, which is that, the maternal mortality crisis has been just such an issue for plans and the Medicaid system writ large to grapple with over the last several years. And there's, been a lot of movement in the right direction, but, certainly plans and states are really being held to a high standard to try to address some of the gaps in coverage, access challenges, et cetera, to really try to bring down disparities and reduce the number of maternal deaths and morbidities that the country has been seeing the last few years. So Kim, the question is just, how does Upstream's work, or partnering with Upstream, how might that enable a health plan to better deliver on their maternal health goals?
Yeah, that's a great question. I think at a high level, one is that screening and the counseling, again, really helps understand what patients are looking for and what their reproductive health goals are and helping to meet them. And then specifically thinking about, it helps health centers increase access to that contraceptive counseling and care, helps providers and care team staff understand what's important to a patient and helping them to meet those goals. And again, it helps plans and providers improve on those performance outcomes on those key contraceptive methods of having access to both the most and moderately effective methods that are out there. We know that also increasing access to contraceptive care is one of the safe, essential, and effective approaches to improving maternal health. It helps individuals basically fulfill whatever their plan is and to have children or not have children when is right for them. And again, having that full range of access to all methods. We know that not all methods work for all individuals, and we want to make sure that patients are using whatever method works best for them to meet their goals. We know that most single young women aged 18 to 29 report that they don't want to get pregnant at this point in their life, but we also know from the research that nearly half of these women aren't using contraceptive reliably or at all. So it's really making sure, again, that we understand what's important to patients and are able to sort of meet those needs. And again, thinking about the work we do, both supporting outpatient access to contraceptive care and inpatient access to contraceptive care. So immediately postpartum, really understanding pregnant individuals and patients, what their plans are for a potential next pregnancy and helping them think about how contraceptive access may play into that and helping them think about things like birth spacing or avoiding short inter-pregnancy intervals, which we know have been associated with some of those adverse outcomes that we see around maternal morbidity and mortality. So I think it really is an important piece of the puzzle of one, just understanding what is important to patients and helping them act on whatever plans they may have about having children, when to have children, and how many to have.
Excellent. Thanks, Kim. I don't see any other questions in the Q&A at this time, but again, we'll do a little pause in case folks are typing live or questions just coming to them now. Please feel free to submit. Okay, last call for questions. No open questions. Okay. Eric, I'm going to pass it. Well, I'll do a little bit of thanks, I suppose, first. Just thank you, everyone, again, for joining. Again, this is our first year as an MHPA partner, so we are just really eager to connect and, again, kind of be creative and think about different ways that Upstream might be able to support your goals around contraceptive care, family planning, larger than just contraception, and maternal health specifically, and think about how we might be able to support you in your work. So thanks again for joining. You can definitely expect some follow-up information in your inboxes in the days and weeks to come. But we were just so thrilled to have the opportunity, and big thanks to my colleague Kim as well for really just speaking so eloquently about Upstream's program. So Eric, I'll pass it back to you.
I will continue the thanks strain in thanking Emily and Kim for their time and for sharing the great work that Upstream does in this space. It's been very great learning about the organization and seeing how far you guys have come in the 10 years coming from one, health center to now over 150 across the country. It's an amazing story and an amazing program, and all the work that you guys do. I will say, if you guys want to reach out to Emily and Kimberly, feel free to do so directly. You can also reach out to me. I'd be happy to connect you as well. I can confirm that the Upstream team are lovely people, and they would be happy to talk with you. As a reminder, this webinar has been recorded, so you can feel free to revisit all the great information that Emily and Kim shared. It will be on our YouTube channel as well, and I'm sure Upstream will be following up. So with that, I will thank everybody, and I'll thank you for attending as well. We really appreciate your time this afternoon and hope to see you on the next webinar. Have a great day, everybody. Bye-bye.